Hey guys, welcome to the Lunge and Lift podcast. Today we're rejoined by a very special guest, Dr. John Houghton. John is a previous show guest in episode 68, where we talk about specific injuries, a lot of talk about tendons, and also his experience in Euro 2020 with the Wales football team. In this episode, we've got some really useful insight around scans and imaging. So if you or an athlete of yours has got an injury, when should you scan? What type of scan should you use? What's the differences between them? And how might that affect your treatment or intervention? So hopefully, if you or anyone you know has had an injury recently, it'll be very insightful as to how you might go about that whole scanning process with or without private medical insurance. But before we get into it, as always, a quick thank you to our show sponsors, thetrainingstimulus.com. If you'd like to learn more about movement mechanics, please check out the website or get a muscle imbalance assessment. And wit-fitness.com. Use our discount code LL15 to get 15% off your purchase. And Hydro, use discount code LL20 to get 20% off your blood flow restriction apparel. Right, let's get into it. John, welcome back. How are you doing?
Good morning. Yeah, I'm good. As I said, I'm now on day 11 of COVID, so still testing positive. Unfortunately, feeling a lot better, but managed to pick it up probably in the celebrations of World Cup qualification last week. So
Congratulations.
yeah, it's been a bit miserable. Been isolating for 10 days now. Thank you.
Yeah. Tell us
But
about the
still,
World
it's a
Cup,
good. It's a
the
Yeah,
qualifiers.
well, obviously, little old Wales. I mean, yeah, it's amazing experience. So, yeah, unfortunately, we had to beat Ukraine to get there. Pretty scrappy game, and it was early June, but I don't think I've ever been so cold in Wales. It was just, the rain was coming down. It was freezing cold on a Sunday afternoon, and we were just soaked through. But we didn't play our best, I'll say, but I don't think World Cup qualifiers are ever great games, but got the result. So yeah, getting ready for Qatar now in November. So yeah, very exciting. It's every boy's dream, shall we
It's
say? So
awesome.
I'm absolutely
Yeah.
delighted. Yeah, yeah.
And what's going to be your focus as the CMO at Wales to get them ready for Qatar?
Yeah, I mean, I think it's mainly going to be divine intervention. I think that going completely off topic here, but yeah, UEFA and FIFA are private organisations that make money, and we've just come off the back of a 2-week camp at the end of a season where we had the Euro tournament last summer. Everybody's had a long season, and then we went straight into an international break where we've asked our players to play another 5 games in 2 weeks,
Yeah.
and for a lot of clubs in Championship, League One, their pre-season starts in a week, and our camp finished on Tuesday. So it's all about getting the games in, as it were. And this World Cup is obviously pretty unique. It's going to be in Qatar. It's not going to be in June like it always
Yeah.
is. So
Would have
it's going to be
started
in
already, yeah.
November. Yeah. So essentially, the Premiership fixtures will kind of finish on Sunday, the maybe 7th or 8th of November. We'll meet up as a team the following day and fly straight there, and we'll have 6 days prep before our first
Blimey.
game. So it's literally on the plane straight after a game. So there's no building like we had with Euro 2016 or 2020, which was eventually last year. It's straight into camp. No get together, no acclimation, no heat acclimatization. It's literally, so we're going to be relying a lot on the players and the individual teams that have those sort of players preparing for the World Cup to try and make sure that they're in their peak. But obviously, that's not the priority for the
No.
individual clubs that own them. So I suspect it will come down to a lot of personal responsibility. All the players that are playing in the World Cup will have to manage, their load, their injuries to a certain degree, because there's conflicting demands, really. So we'll see. I think it's going to be a difficult, an odd tournament in a lot of ways, but it's the World Cup, so you
Are
can't
you going to have to
complain.
give them heat training advice as well? Are they going to get in the sauna or anything like that just to try and pre-acclimate to the heat? Or anything?
Yeah, I mean the problem is the timing,
Yeah.
and ideally you want them to be training in that environment,
Yeah.
and that's going to be very difficult to coordinate. And you know, we might have some players at the top clubs who've got that sort of access to that sort of training, but you know, with Wales, we've got a squad that goes down to League Two, so you know, I don't think, you know, Swindon Town and Portsmouth and teams like that, where we've got players who play, will have access to that sort of equipment, and so it's going to be very difficult. I mean, I think all of the stadiums are going to be air conditioned with the roof on, so it's likely that we're going to be playing at kind of 22 to 24 degrees
Okay.
anyway. So it shouldn't be a
Yeah.
massive factor in terms of that sort of radiant heat from the sun that is really difficult, and less humidity. So I'm hoping that the heat stress is not going to be a major factor.
Because I guess you're going to have to really think about then around the game, like the peri-nutrition and like like how the recovery is. Because if obviously the intensity of the weather outside of that game function is going to be
Yeah,
insane, and for most people
yeah,
that aren't accustomed to that, it's going to be it's going to be a
Training.
unique experience for I think a lot of teams anyway. So it's going to be
yeah,
as you say, like a unique World Cup for not only the time of year but the everything about it. So everyone's going to have to step up anyway.
yeah, absolutely. And yeah, whenever you're at a tournament, recovery is such an important thing. You know, the intensity of those matches is something different. You know, both the emotional intensity and the physical intensity right at the top level. So, you know, the recovery is really, really key. And in all the other tournaments we've been at, that, you know, as soon as the game is over, you know, it's the various. It might be cooling, compression, massage, nutrition, all those things. You know, when they're in the training room as they walk off the pitch, sort of thing, is so important.
Yeah. We could talk about football all day, but that's not what we've got you on.
Yeah,
So let's,
yeah,
let's segue into it. The
yeah,
topic today is all about scans, and we thought we couldn't think of anybody better or better qualified to give us the overview as to what sort of injuries require what sort of scans, the differences between the different types of scans, and how we should think about the whole process of scans and interpreting scans. So, what I think would be really helpful for us and the listeners would be to quickly run through the main types of scans as pertain to sports injuries and sort of how they work and what sort of things they can show us. So, could we kick off with the old school X-ray, please, John?
yeah, absolutely. So, you know, I'll probably split the two main types of imaging into those that use radiation, such as X-ray and CT scan, and those that don't, what we call non-ionizing. So that's ultrasound and MRI. So you know that's relevant for some people in terms of what's going to be better for me. You know, is it best to have a CT scan to monitor this particular problem or an MRI scan? You know, the CT scan has a lot more radiation. So the simple thing is X-rays or radiographs, and again, that tends to be a single two-dimensional image, mainly done for bony injury because bone has a very different profile to soft tissue on plain radiographs. So it is a little bit of radiation, not very much, and it's just basically like taking a snapshot, mainly looking at bones. If you then take that a step further, then CT or computerized tomography is a massive collection of multiple X-rays that are all stacked together so that you can then get a much better two-dimensional and into three-dimensional build-up of internal structures. So it's a lot more radiation, and depending on what part of the body you scan, then you know, there will be a certain amount of radiation to give you those pictures. So it comes at a slight cost. And we sort of, just to give you a bit of background, yeah, we sort of get radiation from the sun naturally. So we're all being exposed constantly to that. And there are some CT scans that might be somewhere between 6 months and 12 months of your normal background exposure to sun radiation in one set of images. So obviously, that can be a deciding factor for certain people who don't want to be exposed to that level of radiation, and can be very difficult in sort of cancer imaging where you've got to do repeat scans a lot of the time. So those are the sort of ionizing radiation type images. And then on the flip side is ultrasound and MRI. So ultrasound uses sound waves that come out of a probe, bounce off certain structures, and the rapidity with which they bounce back to the probe will give them a certain different picture when computed on the screen. So it's a real-time, real movement, no radiation. It's just using sound waves, almost like sonar.
Like a bat sonar, I was going to say, yeah, like
absolutely,
a bat, yeah.
Absolutely. And then the computer gives you an image of what's high echoes versus low echoes, and that enables you to get a 2D image of what you're looking at in real time. And then MRI scan is magnetic resonance imaging, so using a big magnet to line up the various electrical charges in your cells, and different cells have different properties. So bone will look different to fat, which will look different to muscle, which will look different to fluid on an MRI scanner. And again, you can have as many MRIs as you like. There's no radiation. It's just switching the magnet on. So again, MRI has taken over a lot in the last kind of 20 years as the technology's got better for a lot of first line imaging where available.
That's brilliant. Thank you. And just on the CT scan, is that what Americans call CAT scans?
Yeah, absolutely.
Yeah.
Yeah, absolutely. Yeah.
What circumstances would you use a CT scan for? Like what sort of, we've got the X-ray that picks up bones really well. What does the CT scan show us?
Yeah, so again, CT scan is your kind of gold standard looking at bone. So an X-ray can show you, little fractures or a break in a bone or major trauma. A CT scan is your kind of gold standard looking at bone. And when we're thinking about sports injuries primarily, then it's superb for looking at bony architecture when you're looking for fracture healing, for example, or picking up very subtle stress fractures. That can be the sort of gold standard, especially in the spine, but we'll come on to that. So a CT scan is primarily really, really good for bone in the musculoskeletal world. It's very good at looking for organs, livers, kidneys, pelvis, all that sort of stuff. But I think we'll kind of keep that out of today's talks. It's not so relevant to the sort of injuries that we're dealing with. Go on.
Sorry, so I don't know if this is a silly question, but as in have we not got to 3D scans yet with X-rays? Because I would have thought technology, like the way how much we can do, just like, so I know when we had a baby scan like way back, and we paid extra for a 4D one, so you got to go and get an experience. So basically, you saw this whole 3D image of it, right, and then of her, and like some sound and stuff. But obviously, I know the cost of that is where like the main thing comes in. But has it not gone to a state where you can do a 3D X-ray?
So we've got that sort of technology. So you can do 3D reconstructions of CT scans, and you with your baby, that was ultrasound. So the probe bounces the echoes around, and you've got that technology to get that. You can see the picture of your baby now. That's great for certain things. You can see the external makeup of your baby, but for example, if they had a specific heart defect or something else that they were looking for, then maybe 3D is not quite as useful. So, I think there is the technology there, and there might be certain circumstances where you would reconstruct things. So, so for hip impingement, which is a common problem, especially with guys and lifting, that sort of tightness in the hip flexors that people talk about. Often that's just the natural shape of blokes' hips. And so we use a lot of 3D reconstruction to give us a perfect look at the shape of the ball as it goes into the socket to see if it might be pinching in certain areas. So, that sort of technology is coming along and can be used in certain circumstances to ask answer a specific question.
All right, cool.
Brilliant. Thank you. And so we've got X-ray and CT scan as being primarily focused around bones, and we know ultrasound, like the famous use of ultrasound, is in pregnant women. In the sports injury context, what can ultrasound show us?
So in the sports injury context, ultrasound is superb at looking at superficial structures. So in terms of the technology, you have like the probes that we use now are quite high frequency. So what that means is the higher the frequency, the better the resolution that you get. So the better the quality of the picture. But that quality starts to knock off the deeper you get into the body. So if you're looking at a structure that's maybe 1 centimetre, 2 centimetres underneath the skin, then you can get very detailed images. If it's 10 centimetres down, then you won't get such detailed images. You'll lose that resolution. So on the whole, ultrasound is used for a lot of tendon imaging. So tendons around the foot and the ankle that sit very superficially. So, Achilles tendon, patella tendon, looking at the tendons in the shoulder or the elbow. So ultrasound can be really good for giving you high quality images of tendon or soft tissues that are very close to the surface.
Brilliant. And that also show us sort of tendon tears or thickening, those sorts of issues. Is that right?
Yeah, absolutely. And again, there are some subtle differences, though. It depends on which tendon. So, for example, if we're looking at the Achilles tendon or the patella tendon every day of the week, I would use ultrasound myself to look at those. And again, that kind of brings in the point, though, that with ultrasound, it's very operator dependent. So, with an MRI, you get a certain set of pictures or sequences that are kind of kept there forever as a record. With ultrasound, it's moving real-time dynamic images. So unless you record the whole kind of 10 minutes, then you tend to get just snapshots. So it's very difficult for somebody else to look at somebody else's ultrasound pictures and interpret them. So it's very much in the eye of the beholder at the time. So if you're going to have an ultrasound, you want somebody who does that sort of ultrasound on a very frequent basis and is used to looking at the sort of types of injuries that you're trying to answer the question for. So for very superficial tendon injuries, I would always use ultrasound. A slight difference for that might be, say, the hamstring tendon, which is a typical sports injury that I'll see certainly in older athletes as our tendons get a bit older, and especially female athletes around that sort of perimenopausal time. They frequently get problems with their gluteal tendons and their hamstring tendons. And MRI for me is much better at picking those up because they're slightly deeper. Again, on an ultrasound, you're going to not quite get the images that you want. It might be difficult to pick up a hamstring tendon tear at a depth of kind of 8 centimeters on an ultrasound, but an MRI is much better in those circumstances. But for the superficial tendons, so for the kind of guys that you're dealing with, realistically, if it's, ankle, knee tendon, shoulder, elbow, hands, ultrasound's fantastic for looking at those sorts of things.
Brilliant, thank you. And we kind of touched on it there, but so I think MRI is the uber scan, really, in that it shows us the most detail for the most structures in the body. Could you go into a little bit more detail on the situations when an MRI becomes really helpful, please?
Yeah, so MRI it gets you probably your biggest bang for your buck. So it gives you the most information about a particular structure. Like we said, CT can be really good at looking at bone, but not so good at looking at soft tissues. So with an MRI scan, if we take maybe a couple of examples, if we maybe look at the spine or the knee, an MRI scan gives you a really good overview of what the bony structure is doing. It might pick up a fracture, but it's a bit harder to pick up a fracture. But normally, if you've got an acute fracture on MRI or broken bone, just to reiterate, a fracture is a broken bone. There is no difference between the two, and everyone always thinks there is. But, an MRI can pick up a fracture if it's acute because we see sort of bone inflammation next to it, and that's normally where your eyes get drawn to. So it can show stress injuries really well. So stress fractures, tiny fractures where there's inflammation in the bone. It can show you cartilage, so what lines the knee joint and what lines a lot of the joints. It can show you the meniscus cartilage or the labrum in the hip, which are the hard sort of shock absorbing type structures that sit in the knees, and it can show you ligaments really well. So you get a really nice overview of all the structures in the knee, for example. Similarly, if you're looking at imaging the spine, if you scan your lumbar spine, your lower back, then it shows you the bones quite nicely. It shows you the discs that are one of the common causes of pain. It can show you disc tears, disc bulges. It can show you nerve roots. So if a nerve's being pinched, it can show that. And it can show inflammation in the little joints in between the spinal bones. So it's a really nice sort of overview of what you're looking at. And very occasionally, you might, for example, if you picked up a big stress response in an athlete on an MRI scan, but you couldn't quite tell whether there was a fracture or not, then sometimes you then might go on to do a CT scan if it was important to know whether there was a fracture or not. And in a lot of athletes, that can be a really key determinant, because, if you think about your hip, so a common place for stress fractures in athletes is in the neck of the femur, just up in the hip. The MRI is beautiful at showing that stress response in the bone marrow, but you might not be 100% certain whether there's a fracture in there. So a CT, if that showed a fracture, then you might, I'd be saying to people, well, look, on average, it's going to be 20 to 22 weeks before you're back doing everything you want to do. Whereas if it's a stress response, you might have them back in 8 weeks. So there's a big difference for the professional athlete in those sorts of things. So it's got to answer the clinical questions that you're asking.
Does it, when you come to like higher athletes and where is a lot of a cost on their body, do you have to weigh up the effects of a CT scan? Because obviously the radiation that you said about how intense that is, that surely isn't obviously good for us long term. So are you like a bit more reluctant to take them to there unless they really, you feel, as you said, like really have to? So you always go say the MRI route, or like what is ideal there?
Yeah, definitely. I mean, I think, like we were saying, Rob, it's often to ask a specific question. So MRI for the elite athlete is easy, it's available, and is normally the first line investigation because there's no radiation. I think there are certain specific athletes, working in cricket also, and a lot of fast bowlers get stress fractures of a little part of their spine called the pars in their low back. So, if you look at all the England fast bowlers, every single one of them will have had a stress fracture of their pars in the back, or multiple stress fractures. And, in the past, if you look at some of the guys who are still bowling today or just retired, they might have had 20, 25 CT scans on their back throughout their career to diagnose and monitor the healing of those. We're starting to do a few sort of funky things with MRI now, and there's I won't bore you, but there's a specific T1 inverted vibe sequence, which is how you set the magnet up, which gives you almost like a pseudo CT, so it looks a bit like a CT. And we've been using that in our clinic at Fortius now for a couple of years for all our junior athletes who are getting these pars injuries, because again, it's a very common injury in the adolescent athlete, or in cricket, hockey, gym, lifting, those sorts of things. And we can use those sequences now to diagnose the fracture and follow the healing of it. So we're finding workarounds for specific cases, and it might well be that gets expanded to other fractures in the future.
Could you? What is PARS? Is that an acronym for something?
So it's the scientific name. Doctors make things pretty difficult by naming everything stupidly. So the pars interarticularis is the little bit of bone that sits between the facet joints, which are the joints that sit between the vertebra. So you've got this sort of ring at the back of the spine, which is thin, and it's more prone to stress. So any athlete that's doing a lot of heavy work or extending and rotating, then that little bit between the two facet joints called the pars interarticularis is vulnerable. And so it's a typical pattern that we see in adolescent athletes and, fast bowlers specifically.
Brilliant. And I wanted to go back to the clinical question point where the scan and the interpretation depends on what we're trying to establish. And one thing I've heard about MRI scans is basically that if you're looking for a muscle tear, you'll find one, because anyone who trains hard will be tearing their muscles to some extent on the regular, because that's part of like training and training stress on the muscles. So how do you deal with a situation where, say, a footballer's had a muscle strain, and what I've heard is that you don't want to go for a scan, because if you find the scan, they'll find a tear, and you find a tear, that means you have to take time off when you probably don't need it because it's maybe not a severe tear. Could you give us your thoughts on that, please?
Yeah, I understand what you're saying. I mean, we use MRI in footballers and other athletes for muscle injuries on a very regular basis, and I think that's the benefit of having radiology doctors who are they're doctors who just specialize in interpreting imaging. And as time has gone on, they've developed a number of protocols and scoring systems. So like the British Olympic Association, a couple of good friends of mine, Noel Pollock, set this program up when he was working with the BOA. They basically went back over all their sprinters and looked at their hamstring injuries, and they developed a grading system based on what the MRI appearances were, and then they recorded how long each athlete took to come back. And so there's a lot more research published now on what an MRI scan looks like, what grade that is, and how long it might take for that athlete to come back. Now, if you just scan people who are just training regularly, training hard, as you know, part of the training stimulus is breakdown in muscle. So what you might see if you took a typical pre-season or somebody in high training load and you just did a scan for research, you might see what we would sort of call edema, which is just a little bit of fluid in the muscle, so little patches of it. Sometimes, and a radiologist would look at that and say, there's some very minor edema, but the muscle structure is all intact. So this looks like DOMS, or this might just be a bit of stress. But and that's not a sort of thing we would worry about. But there's a very clear grading system of muscle injury that equates to, is there damage to the muscle fibers? How big is the inflammation that's been caused by that tear in cross-section and length from head to toe? And probably most importantly, what we've learned over the last 5-10 years is where in the muscle is it? So if you get a muscle injury around the periphery, near where we call the fascia, a myofascial muscle and fascial injury, then that will get better a lot quicker than if you have a tendon tear with inflammation around in the muscle. So a tendon, involvement of the tendon is the key determinant for us on MRI scan in elite athletes to kind of go, these are the ones that will take more time. So therefore we need to be more cautious in return to play. They're the ones with often a higher recurrence rate and will take longer. So MRI can be really helpful for muscle injuries in that context.
That's really cool. Really cool. And is it clear to see, because as I understand it, muscles sort of merge into tendon. There's not a discrete point where one becomes the other. And I'd love to see MRIs, in like more MRIs, to see how that looks for various different muscles, because obviously some are largely tendinous and others are largely just muscles with a tiny bit of tendon on the end. What's your experience looking at that?
Yeah, absolutely. Yeah, and it depends on the type of muscle, and even within the hamstring, you've got 3 different muscles, and even with like your lateral hamstring called the biceps femoris, that's got 2 heads. So the 2 heads have very different anatomical properties, and we're now sort of moving into that era of being able to say, well, matching patterns of injuries with why that might have happened, and the particular shape of that muscle and the angle that it pulls on, that might be relevant to why this injury has come in and why things might take longer. So, that's where, for me, it's been great working with some amazing surgeons who are the people that, they've got really good brains for putting the scans into 3D because they operate all the time. So they see the anatomy on a daily basis, and So they've seen the scan, and then they do the operation on that torn hamstring tendon, for example. So they get to learn the anatomy and the subtle differences really well.
That's really cool. Awesome. Thank you for that. And one thing I think I wanted to talk about today that would be really useful is in what circumstances does an athlete push for a scan? Like what sort of symptoms might they be experiencing from common injuries that think we need to get a bit of a picture of what's going on here rather than just work based off symptoms?
Yeah. So I think, for the general athlete, if we kind of split it into trauma, so an acute injury and an overuse injury, and obviously overuse injuries are more common because of the very nature of the sport that you guys are dealing with. Now, if you have an acute trauma, then that's probably a reasonable time to think about maybe going to casualty to get an X-ray. So, if you have a skiing injury, or if a bar lands on your arm, or you snap a finger back on the bar, or you catch it in something and there's a deformity, for example, then that's a reasonable time to go and take the pain, sit in casualty for 6 hours, get an X-ray, because X-ray is good for trauma, and especially around the periphery, so hands, feet. If you've had a sudden trauma, an X-ray is going to say, is there a break? And often if there's not a break, then the management is a little bit different. And the way it kind of works in the NHS is if there's a break, then you go to fracture clinic and you see an orthopedic doctor who says, put this in a splint or a cast or whatever. If there's no break, then you're unlucky, because they just say, off you go, it's not our problem. And that's when acute injuries can become chronic, because often that means a potential ligament injury that you're not seeing on an X-ray, which can keep you out for a long time, for example. But that's when X-ray is good for that sort of trauma. I guess the other time to think about getting a scan with an overuse injury is all about, how much is that affecting your performance? So, if you've been carrying something for a few weeks that is, you're having to sort of adapt your training sessions significantly, or you're having to skip sessions, or certain things in your session are so sore that it's affecting your performance, then those are the times when it's going to be useful to answer that question as to, it's getting in the way of life and it's stopping me from progressing. I can't do it. The other time to think about it is if it's really upsetting things like sleep or work. Because, I know, Rob, you talk about this all the time with your clients and the guys or girls that work in the city, and they're really busy, and then they're not sleeping, they're not eating. So that if it's getting in the way of your sleep and your recovery and your ability to function, then that's clearly not going to be a good thing for you going forward. So if it's either getting in the way of normal life and recovery, or it's getting in the way of performance, then that's a reasonable time to be saying, maybe I should get a scan. If you've got a niggle that you can fully train with and it's not getting any worse, then, the rationale about, I just want to know what it is maybe not as useful.
Yeah, it's definitely something that I think with myself, and how I would interpret that was just how, if I can be bothered to sit in the NHS waiting room for 6 hours, it better be worth it. So I better be in a serious amount of pain, if you know what I mean. Because if it's really going to cause that much discomfort that I feel I have to go for a scan, because we don't obviously necessarily have the luxury to get them as and when, it must be a bit of an issue to have to go through it. And I think that's also quite a good barrier, because for most general public people, that if they were getting regular scans, whether they're X-rays or MRIs, and you start over-analyzing things, because especially within like the CrossFit community, how, and I say within the fitness community as a whole, I think it's really growing into a whole lifestyle way of doing things, where you are analyzing your movement, your sleep, your nutrition. You're analyzing so many parts, and it won't be long until we're analyzing the inside, if it becomes a lot more readily available. And then you start, so like ultrasound is an example, where I remember past show guest Franco going to see him, and he got a ultrasound machine. And when I had I messed up my wrist, and he was able to use it on my wrist because it's really hard to see there. So using the ultrasound was a really cool way to kind of see where there was some inflammation or any issues, and he was able to diagnose it better. But if that was my machine at home and I'm having a look at my own, and do you know what I mean? It's just you go down this rabbit hole of unnecessariness. At the moment, having the barrier of a 6-hour wait for a scan kind of gives you that, is it really worth it?
Yeah, 100%. And you'll know this when you're dealing with, well, professional or non-professional athletes. There are some guys and girls that are mentally very robust, very certain about their bodies. There are others who are just anxious and they worry worry about every little niggle and every little pain. And I've got several professional athletes that I've looked after who the list of their scans is huge, and you often that then comes into the psychology of it is sometimes we've used MRI scans to reassure an athlete that they're like, oh, I can still feel something, I'm not happy. But if I see a scan that says it's fine and there's nothing on the scan, then I'm happy to go out on the pitch and perform. And that's where we sometimes use that, and you can justify it from a performance point of view. But we're lucky that MRI doesn't have radiation, because otherwise you're then juggling lots of those sort of scans that you've got to weigh up the benefit that you're going to get from doing the scan. But you're right. If you've got an anxious athlete, then how they deal with injury and pain will very much also determine what they need. So it will vary from athlete to athlete, definitely.
Because I definitely think we've got an insight into this, because it's like with things like all the sleep trackers and stuff like that, and people then affect their training based on the sleep that they've had the night before, based on a tracker which is semi-accurate. And when I say semi, I mean super semi. So it's like, it's the fact that that is already impacting someone's performance, and they're not necessarily getting an internal feeling of, today's not a day to max out my deadlift. Maybe it's what I'm going to do, say a set of 10, a lot lighter type thing. And it's crazy to see how this self-interpretation is already affecting people's performance in this way, that I wonder down the line when, because at the end of the day, this medical stuff, as you've been talking about things in like past 5, 10, 20 years, so you've been dealing with stuff for ages, and it's only just coming into more consumable because it's lower cost and wider market. So I just wonder when these things start to become more like using HRV as an example. Like how people then, like, again, I know there's a lot of questions, doubts about HRV and how accurate that stuff is, especially on the consumables that people wear, like how they wear it. So it's funny how it just worries me, the thought that then we start having these portable scans that people are like, oh, my elbow's a bit sore today. Oh, that's why. There you go. That's the inflammation.
And listen, I totally agree. It's the quality assurance needs to be really good. And ultrasound 20 years ago was high resolution ultrasound was still relatively new. So not many people in the sports world were trained in it. It was mainly just radiologists. Whereas now most sports medicine doctors, quite a lot of physiotherapists might have access to diagnostic ultrasound. So you've got a lot more people now using it. So that's where the sort of quality assurance needs to be done. So whoever's got the ultrasound in their hand, you need to trust that they've been trained properly, that they know what they're doing. Similarly with MRI, because we're doing so many more MRI scans, we've not trained a bunch more radiologists in the last 20 years. If anything, it's probably less. And so, we might get to a stage in 10 years where there's even more high street MRI scans, whole body scans, all that sort of stuff. And you're going to have people maybe reporting those that are not as well trained. And I think, we chatted a bit about this earlier. And it's very easy for people to kind of get into the trap of thinking that what's written down on a report is absolute truth and gospel. And I did this when I was a junior doctor working in hospitals. We'd be organising X-rays and CT scans on people, and you get the report back, and you just thought that was the truth. But ultimately, any form of imaging is just one human being's interpretation of some pictures.
Yeah.
And that interpretation can be very, very different depending on their experience, their level of training, their involvement in sport. And that's where, for your clients, for the people that listen to this podcast, it's so important to have the right experts who are used to looking at those images and interpreting what those images say in context with the injury that's sitting in front of them and the human being that's sitting in front of them, because different scans will mean very, very different things.
Yeah, that's where I was kind of wanting to get to, because I think the interpretation is the most important part, as you've mentioned there. Because when I've gone for MRIs in the past, say when I had a back injury, and I had two different diagnoses. One was from the general GP saying, right, cool, you've got a bulging disc, this is the issue, da 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 da. And then talking to a sports physio, and showed him the imaging and stuff like that, because they gave it to me on a CD and stuff. So I gave it to him. I was like, right, check this out. He looked at it and he was like, cool, this is what you have to do. This is how you're going to get back to training. And I guess it's then that interpretation of the GP person is looking for you just to get back to homeostasis as close to as possible, whereas the person that sports physio is looking at it saying, right, let's get you back to training, let's get you back to working above and beyond what the human body is necessarily capable of.
Yeah, absolutely, and the interpretation is key to everything, and especially if you're getting scans on your neck or your back. The spine is the classic example, because it does a lot of work for us over the years, and we know that you will start to see what's termed degenerative discs. So unfortunately, it often gets termed as triple D, degenerative disc disease. It's not a disease at all. Basically, we know that by the age of 30, which is going to cover a lot of your clients, if you stick them through an MRI scanner, you're going to have about 40% of them that will have what is classed as a degenerative disc on an MRI scan. Now, does that mean that 40% of the people who are 30 years old shouldn't be lifting? No, of course not. And it's all about interpretation. That's the natural aging of the body. It's like your hair going grey or losing hair, and it happens quicker in some people because of genetics or load or injury. And it's all about that complex interaction of what's the athlete in front of you, what are their current symptoms, and what does the scan show, and can I match their symptoms to the scan, and does that make a difference? So I think definitely scanning spines and backs is fraught with danger. And I say to people, there will be abnormalities on your scan. So let's do it. We want to maybe exclude something nasty if this has been hanging around for 3 months, which is very, very rare to pick up. And then we're going to see if there's a specific target for treatment that might change our management here. And, can we see that the disc is bulging at that very level that would press the nerve that is in the area of distribution of your pain? And that's really where you've got to have a team of the right people, ideally around you. So at the elite level, we have our what we call MDTs, multidisciplinary teams. And every Friday morning at Fortius Clinic, we've got 2 or 3 of the best sports radiologists in the country. We've got the guys who are operating on the Premiership, football, rugby, top athletes, and we all sit in a room and we bring the imaging and we discuss them. And, that way you get the best answers from a huge experience of surgeons, sports physicians and radiologists. And I think that outside of the elite world, then the key people really are probably, in terms of helping you with imaging, is to some degree sports physios. Some of them will have some experience of that. But I think that the sports doctor or the sports physician is probably the perfect person to help you interpret that in the context of an athlete and an injury, and work with your PT, your physio, or refer you to a sports surgeon if they feel that that's appropriate, because they have the knowledge of imaging. A lot of them will ultrasound themselves diagnostically. They have that medical knowledge of, they're used to seeing scans on a regular basis because that's what they do. And they have the more sports specific knowledge and experience of looking after an athlete. And yeah, we spoke about this the first time I was on the podcast. You know, my starting premise with every single patient that walks through the door is normally they're there to see me because they want to keep doing activity. They want to keep doing their sport. They want to keep training. They don't want someone to say, "Oh, your scan shows this amount of wear. You just need to stop lifting. You just need to stop running."
Yeah,
You know, that's not what they're there for. And so
Yeah.
the starting premise of every sports physician really is that, you know, I'm here to try and help you keep doing your sport and advise you on whether we need to do something differently for a while, or, you know, very rarely is it that I say to people, look, you know, my advice is you just stop doing X. You know,
Yeah.
that's so rare. But you've got to have that knowledge across sport, imaging, and the injury to be able to do that accurately.
Yeah, I think that's a really important point, and probably the primary frustration with athletes seeing doctors, getting scans, is they don't feel like they're understood in terms of how they want to use your body. And this is definitely my experience in the early days, a long time ago, with my shoulder injury, was that it would basically be, can you button up your shirt? If you can button up your shirt, then you're good to go. And I was like, but
Yeah,
there's so much left that I want to do with my body that hasn't been addressed. And I think
yeah,
it would be really useful if you have any advice for athletes in that situation where they're seeing their GP, they're seeing maybe a normal physio, and they're getting real basic advice on how to return to baseline function, but they want to be treated to return to high level function, even if that's just training hard in the gym. Do you have any pointers other than obviously coming to Fortius and seeing the best of the best?
yeah. And listen, I get it, and you know, probably 70% of the people that I see have private medical insurance, so it makes life a lot easier because I can say, you know, this is the best scan for you, and this is what this, and we're going to do it, and then we're going to talk about it. So it does make life very easy. And one of the hardest things I find is trying to manage people who are on a much stricter budget, because you're trying to sort of work out, you're trying to bring cost into healthcare, which
yeah,
leads to some difficult conversations. I mean, I think in terms of how I would advise that is that, you know, if you don't have insurance and let's say you've managed to persuade your GP to get an MRI of your shoulder injury, now, you know, in some NHS areas, you might get a scan relatively quickly. And when I say relatively quickly, that, you know, in the NHS for a musculoskeletal problem, 6 weeks is really quick. You know, I was talking to one of my buddies who's a sports doctor in Wales, and at the moment it's 18-month wait for musculoskeletal MRI scan. So, you know, and he's kind of looking after Commonwealth Games level heptathletes and the like, and having to wait 18 months for a scan. So there are places where it's very, very difficult. But if you have managed to get those pictures, then, you know, by all means, get hold of the report, but then you need to go and see someone who can help you interpret that. And I think you kind of made the point of a normal physio. I think that certainly in London, where you guys work and I work, there are plenty of really good sports physiotherapists. So people who primarily have got an experience of sports and training injuries and musculoskeletal problems, and they're a good first point of call to go through some specific, you know, reports, images, examine you, try and match up the two, and advise you. And again, it's all about that teamwork. You know, the good ones will either say, okay, well, let's, you know, you're on a budget, or let's do 3 sessions, and if you're moving forward, great, we keep going, and then we'll get your PT to do X, Y, and Z. The good therapists are the ones that after a few sessions, they're not changing it. They'll go, listen, I think you need to go and see someone like John, or you need to go and see this person. And we build those relationships over many years so that, you know, we get the right people to the right place. I think the other thing in terms of, you know, looking at things on a budget, there are a lot more MRI centres now that are standalone, so they can reduce their costs. So they're basically just an imaging centre, and there's a good number of them in London. You know, Vista, Orion, European Scanning Centre, quite a few that you can literally self-refer. If you're prepared to wait maybe a week, 10 days, and go at 7 o'clock in the morning or 8 o'clock at night, then you might be able to get a single part MRI somewhere between 200-300 quid. Now that's the rough guidance on that, which is compared to in a private hospital, it's probably a third of the cost maybe. So that's not a bad option for a lot of people. But again, I think if you've got a sports physio or taken advice beforehand, then that's the best thing, to make sure you're scanning the absolute best part and choosing the best modality of imaging to get, and that will give you the best answers to what you need to do with that. Does that make some sense?
Massively, yeah. I think that'll be really helpful for a lot of people. Thank you. One other way, I guess, to save money or to not waste money, are there any situations where a scan wouldn't change the treatment? Any common situations where you think, you know what, given your symptoms and what we're seeing, even if we scan and we see what we think we're going to see, or we see there's nothing that we could see that would really change what's going on? Are there any common situations like that you can think of?
Yeah, I think, often, if I kind of reverse it, when I'm using imaging, I'm looking for a number of things out of that. Like I said, often we're kind of, if there's a chronic pain, and when I say chronic, what I mean is that's a duration, length of time. When I was a kid, I just thought that chronic meant really bad. But chronic is normally sort of 3 months or more of pain or an injury. Now, there are certain situations where the first thing I'm doing is excluding something bad and nasty. Now, I'll have normally asked them a bunch of questions to do that anyway, and it's just the sort of automatic tick that off the box, get that out of the way. The second reason for imaging is to confirm a diagnosis. And I think that's really important for a lot of people, because I still see people who've been going around the houses, physio, chiro, osteo, doc, surgeon, and they don't have a diagnosis. And mentally, that's really bad for them.
Yeah, the open loop.
Now, and sometimes people sort of say, yeah, but, like for an example on the spine, is degenerative disc disease a diagnosis? Well, sometimes it's good to try and put a label on something so that you can then move forward with it and help that person understand what the relevance of that label is. And we then, within medicine, have certain treatments that we research and study against certain conditions and diagnoses. So it helps us in the treatment decisions and helps us to get a plan together so that we can say, okay, we've excluded anything that needs X, Y, or Z. So this is how we're going to move forward. Often that scan might be for me to perform an intervention. So I'm looking at it going, right, does that confirm my clinical suspicion that this is a bursitis in the shoulder, for example? And therefore, I know that this person's had it 3 months, they're not getting better with physio. If I put a steroid injection in that bursa, that should reduce their pain. They can do more in the way of rehab, get their strength back quicker, and improve their movement patterns because there's less pain. So I'm constantly thinking, what's the intervention I'm going to do if it shows A, B, or C? So I think probably one of the areas where imaging rarely changes what I do is the spine imaging. And we talked a little bit about this before, because it's so frequent to see age-related abnormalities sort of in the neck or the lumbar spine, for example. And if someone's had a bit of backache for a few months, then, if they've not had any treatment, I'll sometimes say to them, look, there's nothing worrying, there's nothing damaging. I've examined you, the nerves are working, the muscles are working. You don't really need a scan. Interestingly, these days, that's so hard. If somebody comes to see me, they're expecting a scan. And sometimes it's not worth my time trying to argue not to have an MRI scan. But I think that I would say that an MRI scan of the spine probably doesn't change my management on a more frequent basis than other injuries and other parts of the body. But, if somebody's had a good physiotherapy input and they're not sleeping because of pain, then we're thinking, do they need an epidural or a specific injection or an intervention? So it's those ones in the early days where they've not really had any treatment. It's just a grumbling injury that's niggling. Then rarely is the imaging going to make me want to go, right, you need this, you need A, B, and C. It's often just, you need some therapy, you need to change your movement patterns, you need to improve your strength there before we would do anything anyway. So it's the early stage injuries that are niggling and not interfering with performance or life that probably don't need scans in the vast majority of people.
Yeah, I really like that, because this, for me, I think like having the way to close the open loop for saying, okay, diagnosis, like, so people can say, okay, this is the injury, and I can now know I can then manage it and deal with it appropriately. Because where one of my clients, she tore her MCL and went through the rehab side of things, had a compression sleeve on her knee for quite a while and has worked her way out of that, but she still has a lot of issues and struggles with running. Basically, she can't run at the moment, and it's just made me think that potentially, because I know she has private healthcare, that maybe her getting another MRI to kind of maybe tell her the update of the knee might actually help her with closure. Because I know when I've had injuries, I'm like all over the body, and I've kind of had the approval from, like, say, the sports physio or something. I say, like, it's fine now. Within the next week or two, that my mind's had the time to say, right, you're sweet now, move on from it, and then you deal with it, rather than, because I know she also had, it was crazy, she was doing a Turkish get up in the gym, and she was like midway with the weight above her head, the kettlebell above her head, and someone's walked into her, and the kettlebell's gone down, and it tore her labrum in the shoulder. So she done that and got a scan and stuff, said, right, yeah, you've got this tear, and they potentially were going to do surgery. Thankfully didn't, rehabbed it back, and a year later she's completely fine. If anything, she's stronger than ever on that shoulder. But because she then found out what it was, but she said, oh, in your shoulder you've actually got loads of things going wrong in there. So not just the tear, there was all these other things. And then she was like, what? But it's like, it's normal for someone who trains. And that's the thing, it's that, as you say, that interpretation as well.
Yeah, absolutely. And I'm sure if we stuck you guys through an MRI scanner,
I'd love that.
Top to toe, genuinely, we'd come up with 50 things. I kid you not. All the joints that are involved, we'd be able to write all these things, and you're there going, God, I feel great. I'm hitting my PBs. I'm moving well, but it's so important, and it's different injuries affect different people in different ways as well. So your client, what she needs out of her shoulder is very different from a throwing athlete who's got a labral tear, or a rugby player who is got a labral tear that is going to lead to instability. And so again, it's not just the interpretation of the scan and the images, it's then matching that to the individual and the athlete and their goals and their desires and their demands, because those injuries will be treated very, very differently. And imaging is one stage of that journey.
Massively. Yeah, I think that specificity of, like, what does the athlete need out of their body is often a missing piece with treatment, where it's generic shoulder function versus specific shoulder function for their sport. And if you're able to tailor your rehab towards the specific use of the shoulder, it massively improves the results that you're going to get out of it.
Yeah, 100%. Yeah.
Amazing. John, I want to be respectful of your time, so I think we'll wrap it up there. But thank you so much. Pleasure. I think it's been an incredibly helpful episode, and a lot of people will gain a lot of clarity on whether or not they need a scan, which sort of scan, and the fact that I think one recurring theme through the episode was the peace of mind, like just knowing what's going on with greater clarity, whether you need an intervention or not, can make you feel a lot better about an injury that you don't quite understand, especially in the early stages. So thank you very much for your time.
Yeah, really appreciate it.
Pleasure.
Where can people find out more about Fortius, or if they want to get a scan or anything like that?
Yeah, so like I said, as per last time, if any of the people who are listening, if they want to contact you at the podcast, more than happy to give out my personal email if they've got any questions. I'm at the Fortius Clinic in London. We've got a branch in the city, one in Marylebone and one in Wimbledon. Quite easy to find me on the website there. But there's a group of about 80, 90 doctors bunch of surgeons, pain consultants, about 15 sports doctors. So, we've got a really good network with a lot of the sports physios already in London. So, any questions, I'm more than happy to answer the odd thing that you want to send through.
Appreciate that, mate.
Thank you very much.
That was really interesting to dive into the more detailed components because, you hear these words, X-rays, MRIs, and you know a baseline understanding of kind of what they are, but it was really interesting to understand more about them and also when to use which ones. So really cool. And I think the key thing that I really took away from that was that interpretation and also having an idea of the correct person looking at your imaging and then being able to tell you about how to get to where you want to get to rather than just where they think you should be, where you actually want to get to. So that was really cool. So we really hope you enjoyed it as much as we did. And if you did, we would love for you to share it on all your social media platforms. Don't forget to tag us at lunge.lift. And if you did enjoy it and you fancy leaving us a review, you sure can head over to wherever you're listening to this, either YouTube, subscribe, leave a comment, and we'd love that. So thank you as always for your time. We appreciate it, and we will see you next week.
Thanks, guys.